Hey guys, in this video, I'm going to share with you one of my favorite strategies to improve knee extension. Knee extension is getting that leg straight, and it's called a prone hang. Now, prone just means laying on your stomach. Hang just means letting that leg hang into extension, letting gravity do the work. I'm going to talk about a couple of the things that might get in the way of using this strategy effectively, and I'm going to share this, which is a tool that I use that really kind of gives you that little bit of an edge to make this strategy more effective. So stay to the end. I'll show you where you can get these compression wraps. They've just been incredibly valuable for me, my patients, my practice, and they're really inexpensive. So guys, let's start with a prone hang. But first, a couple of things to consider. If you have problems laying on your stomach, now I'm not talking about sleeping on your stomach, I'm talking about just positioning on your stomach. A lot of my clients are also dealing with conditions related to the low back pain like spinal stenosis. They don't do well laying on their stomach, so I never make anybody who has any back issues in the prone position do this exercise. It's not that important. There is no exercise that's that important that you have to suffer through positioning. So if you have no problems with spinal stenosis, you have no low back issues, you're comfortable being on your stomach, this might be a great option for you to try. Now, very simple. Let's pretend for a minute that I've got a right total knee replacement. I can start using this strategy truthfully from day one out of the hospital. Even if I still have a dressing over the incision, even if I still have staples in, and I'll show you a couple ways to kind of make positioning a little more comfortable, this is really a safe and effective strategy from the beginning. So, excuse my wires here, I'm trying to keep the audio as clear as I can be. What you're gonna do, quite simply, if I'm at home laying in a bed, most people will have some sort of a footboard at the end of the bed. We can't do it in the traditional sense. So in other words, if my bed runs lengthwise this way, and I've got a headboard here and a footboard here, what I'm gonna do is I'm gonna turn my body 90 degrees so I'm laying across my bed horizontally. This would be the side edge of my bed. My headboard is there, my footboard's behind me. The side edge of my bed, what I'm looking to do is lay on my stomach and allow my foot and ankle to hang off the side of the bed. Now, if this is just too uncomfortable, let's say you're limited in that knee extension, you just don't have anywhere near enough range to get there, I would scoot up. And so if I flex my ankle, what that allows me to do is it allows me to kind of create a little bit of support. I can also place a little bit of a towel roll down there under the shin, under the ankle. Give me just a second, I'm gonna show you what that looks like. Okay, I'm back. So I'm just gonna use a standard pillow. And what I can do is if I fold this pillow over, this can give me a little extra support. Let's say I'm fresh out of surgery and I don't have more than, I'm limited in 15 degrees of flexion. So what I would do, I'd go on my stomach, and now that's gonna give me a little support. But the goal is I wanna have enough of an extension stretch on the knee that it's uncomfortable but not painful. And that's always the challenge, is finding that level of discomfort but not pain. Once I feel like I can progress beyond this, I can do what we call an isometric quad set. So I tighten my quadricep muscle. If you guys can see, I'll try to zoom in the video. You should see that my leg goes straight. And what I'm really doing is I'm kicking down into the pillow as I tighten the front of the thigh, the quadricep muscle. Okay, now, if I do enough that I've progressed beyond that, what I'm looking for now, as we mentioned in the beginning, is I'm down here. I'm trying to let this drop down. One of the things that gets a little bit uncomfortable, remember, you still have a kneecap, and so the weight of the leg pressing down makes that kneecap a little uncomfortable. So a lot of times what I'll explain to my patients is, if you can get into close to end range extension in this position, laying on your side, straighten that leg, and then you can come down. It's a little more comfortable. Another option would be to take that same pillow you were using in the beginning, lay it up under the thigh. So now that kneecap can float in the air and it can move freely. This is going to get me just as much extension, but I feel like I'm still laying on the bed comfortably. What some people will do is they'll scoot all the way down to the edge of the bed. So again now, both my legs, I know they're hanging off camera, but are hanging into extension. My thigh is supported by the edge of the bed. My kneecap is not being compressed. There's no pressure on the incision. Problem with this is there's a lot of pressure on the knee. So preferable, better than this position, would be up on the bed, fold it over, pillow under the thigh, and we just relax right here. You know, I might spend 5 to 10 minutes in this position. Now, let's say we've been doing this for a couple of days, maybe a week to 10 days, and I'm still just not quite getting the extension that I want. I feel like there's some swelling. If you guys remember, many of you may have had a Baker cyst behind the knee, a pocket of fluid. So that is where I bring my secret weapon. So this is a compression wrap. This particular one is the most comfortable one that I found. Now certainly something like an Ace Wrap, a 6-inch wide Ace Wrap would work great. They just don't provide a lot of compression. They're very soft, very flexible. Something like this is designed for athletes who are doing heavy back squats and they want something to squeeze the knee. That's ultimately what we're doing. And so if I'm going to use something like this, what I do is I start with a comfortable compression wrap right below the knee. So my kneecap is right here. I'm about 3 inches and then the wrap. What I like about these also is it has these 3 lines, these decorative lines. And basically what I do is those lines help me line up the spiral wrap so that I'm covering 50% of the previous layer each time I go around. The Velcro allows it to stay intact, and if it gets too uncomfortable or I feel like I need the circulation again, I just pull that and it'll come right off. But basically, so now what's happening is I've got a counter pressure on the swelling that's already there. So inside the knee you have a fusion, you have swelling around the joint that's pushing out. That tells my nervous system that we need to be protective. We need to be careful. What this does is it creates a wraparound compression that balances the outward pressure of the swelling with the inward pressure of the compression wrap. It tends to make clients feel more comfortable, more stable, less anxious about, you know, the pain and everything that's going on in the knee. And as a result, when we go back into that prone hang position, we tend to have better results because 1, it's pushing some of the fluid out of the area. 2, it just feels more comfortable. It feels more stable. I don't feel like it's just gonna, you know, break off my body and fall on the ground. So again, this is one of those positions I'd spend 5 to 10 minutes. If the compression wrap is too tight, you'll feel that pulsing, aching into the foot, the toes. Obviously, that's not a good sign. That's something we need to address and not do it again or do it at a lower, lighter compression. But this should be comfortable. This should be a position you could spend 30 minutes in, but we're gonna focus 5 to 10 minutes because once I finish here, then I wanna go do some other exercises because we've gained range of motion. Now we have to strengthen in that new range of motion. One of the principles that you should have learned in the clinic was half the battle is getting range of motion. The second half the battle is keeping that range of motion. I'm sure you experienced this. You get 5 degrees of flexion, but then all of a sudden you lose it an hour later. The goal is we want to get the improvement in range of motion, then we want to strengthen in the new range of motion. So if you're normally limited to 90 degrees and you get to 95 degrees after doing some stretches, you want to do some exercises in 95 degrees of flexion to help your body get used to that new range of motion. Okay guys, I covered a lot. I hope this was helpful. If you have any questions, let me know. I'll put a link in the description down below for where you can get the compression wrap on Amazon. I'll also show you where you can get a little bolster to put under the thigh if that makes it more comfortable. You know, part of recovery is just doing it. And so if there's anything you can get to make it more enjoyable, make it more pleasant, go ahead and do it. Like, you need some sort of reward system to make rehab tolerable, and you're the only one who knows what that reward system is going to be. Okay guys, I'll catch you on the next video. As always, please subscribe and post your questions below. I love hearing your feedback, your comments, what works, what doesn't work. So I always appreciate any comments I get on YouTube. Thanks so much, guys.